90% of them that have symptoms like this, 95% of them that have symptoms like this, it is intervertebral disc disease. We would need a radiograph and MRI to confirm. Radiographs a lot of times are important also to see the extent of the vertebral malformations that are in there, which gives us a better prognosis as to, you know, if you think about it, the more vertebral malformations he has, those are like landmines. It's like, it doesn't mean that they are going to explode, but the more he has, the more likely it's going to happen or have reoccurrence, or you know, it might be, here's the problem he has this time, well, it could be 2 vertebrae above or 2 vertebrae below, depending on what malformations you have.
Yeah.
I like to see it just as a baseline, and especially for me as a chiropractor doing chiropractic, I am not going to do a chiropractic adjustment on him without doing a radiograph to see, you know, am I adjusting on something that is just not functionally normal anyway.
Yeah.
So I don't want to adjust on that, and all of a sudden it's like, oh, now I'm creating a problem as well. So typically, like a dog like this, I don't normally do too many adjustments.
Yeah, we've heard that not to do.
Yeah,
chiropractic.
no, especially because of the malformations. If I had an X-ray, sure, I certainly would. Absolutely, I would have no problem doing it, and especially because I can avoid some of those things. All right, so options that you would have. Surgery is one option, all right? So that's where they end up going in, depending on what the radiographs and the MRI say, they'll cut windows in those vertebrae, and it allows for the disc to extrude out a different way, not put pressure on the spinal cord or on the nerves coming off the top. So that's one option. Other options, since he still has deep pain, he still has some functional mobility, he still has some of those, we can try conservative treatment. This is 4 to 6 weeks cage confinement.
Yeah, we're doing that.
Yeah, and even if you do the holistic stuff that I'm saying, I normally like more movement than just cage confinement. I do like them to actually have some mobility, but we're still confining them to a very small area.
That's what we,
Yeah, something like this size where it has very good footing, no, carpeting, either carpeting or padding like this, no slippery floors. So that's normally what I do. So, and for my case, where we have seen some significant improvement is using acupuncture. And we usually use acupuncture with electric, or I really like to use the PEMF device, which is PEMF is pulse electromagnetic.
Is that mat?
It's either a mat or I use a MagnaWave. So I use a MagnaWave.
I have a question.
Yes.
We have seen those, like it's been, because obviously like I've been researching because this is, he's my child. When you're looking to, I have a red light therapy laser thing too. Is there a wattage, or is there like how do you know that you're getting the right PEMF?
You need to research the company. So this is probably one of the top companies in the world. The MagnaWave. There's a couple other ones. Beamer is a really good company. CC is a really good company. Those are the good companies that I would recommend for PEMF devices. I use MagnaWave. It is the most powerful unit. It is also, I can adjust it to where it goes lower to higher depending on what the dog can tolerate and what I'm looking to treat. And in this case, I use it with my acupuncture because I'll stick the acupuncture needles in and I put the MagnaWave over the top of it to stimulate those acupuncture points. Or what we'll do, and there's some really good research studies about using acupuncture for this, and what we do is we hook up electricity directly to the needles themselves, again, to stimulate the effect of it. So these are the options that we have for therapy or for treatment. You could do nothing, which is just let them sit there and cage confinement. I'm not a huge fan of that because you get what you get, and it's like you're not doing anything to actually help with recovery, not doing anything to help with the muscles, not doing anything of that nature. At a minimum, we should be doing something like acupuncture, and in my position, using acupuncture with electric or PEMF to actually cause some stimulation to help healing, or cause some stimulation to help with the muscles. All right. Then after that, then the other thing that's really critical is rehab. So there's exercises that we would do. And there's even exercises that are